Hello, this is Brian Casey of Casey Insights, and we are here at the Biotech Showcase in San Francisco. I'm pleased to have with me right now Martin Willemink. He is founder and CEO of Segmed. Martin, thanks for being with us.
Thanks for having me, Brian.
Now, Martin, Segmed is a little bit different from a lot of the other companies we've been talking to because your products aren't really used clinically, they're more for research. Can you talk a little bit about the idea behind the company?
Definitely, yeah. So all these companies, they need data to develop, a lot of them develop AI algorithms, right? And they need the data to actually be able to train those algorithms. So the idea behind our company is, I used to work for 5 years at Stanford where we did a lot of medical research and we needed data to develop AI algorithms, for example. And it took us a long time to get the data ready before we could even start with the fun stuff, before we could even start developing the AI algorithms. On average, it took about 18 months to get data ready. And in order to cut down that time, that's why we started Segmed. So what we are doing is we are working with health systems and hospitals, integrating with their IT systems. We are de-identifying the data, structuring the data, and then making it available for AI development by sending it to our proprietary data warehouse in the cloud. So in the cloud is where we have developed our core product, which is called Segmed Insight. And that is a product where our customers, who are companies that develop AI algorithms or that need medical data in general, they can log into the platform and they can build a cohort of de-identified and structured data that they can use right away for the development of AI or for other purposes for medical research.
So most of your customers are actual AI developers?
Yes, so most of our customers are, for example, diagnostic AI companies, diagnostic radiology companies, but we also have larger medical device companies, we have pharma companies, we have big tech companies, some unexpected companies like surgical robotics. Any company that needs medical imaging data, because the core of the data that we have is actually medical imaging, but then we also can correlate that with other types of data. So a typical use case, for example, is somebody wants to develop an AI algorithm to detect lung nodules on a chest CT scan. So you need the chest CT scans, but then you also need to know whether these nodules, are they benign or malignant? So there are multiple ways of finding that out, and one way is, for example, if a radiologist took a biopsy of the nodule, you know, the pathologist has looked at it and has said, oh, this is benign or malignant. So that's the kind of additional information that our customers need to determine the value of these nodules for their AI algorithm.
Now here at Biotech Showcase and at JP Morgan, pharma development is a huge thing, and so there's a lot of pharma companies here. There's a lot of investors. Is that an area that you guys are targeted at?
Pharma is a big thing. So we don't have that many pharma customers yet, but we actually just hired our first salespeople that are going to reach out to pharma companies. So the pharma companies, they should get ready for us. So we have some pharma customers already, but we know that there is a lot of need for medical imaging data there, so we're definitely going to go after that.
Great. And what else are you talking about here at Biotech Showcase and JP Morgan? Who else are you meeting with?
A lot of investors. We talk with some customers, investors, partnerships, these kind of things. So we have raised so far a pre-seed and a seed round and a seed plus round, and we are later this year planning to raise a Series A. So I'm doing a lot of coffee chats with investors to get to know them and to get ready for the Series A round.
This is the place for that. Well, Martin, thanks so much for being with us, and good luck to your company.
Yeah, thanks for having me.
All right. Signing off from San Francisco, my name is Brian Casey.